three arteries. The first one, or the main one, is the internal iliac artery. The second one is the median sacral artery, this one. And the third one is the superior rectal artery. The internal iliac artery arises from the common iliac artery. The median sacral artery arises from the abdominal aorta. And the superior rectal artery is the continuation of the inferior mesenteric artery. Start by the median sacral artery. This is the median sacral artery. It arises from the abdominal aorta at the level of L4. It terminates at a fibrocellular body called the glomus coccygeum, formed of arteriovenous anastomosis. This median sacral artery gives the branches to the rectum and the branches to the sacral canal. It also gives the fifth lumbar artery. The upper four lumbar arteries arise from the abdominal aorta. So the median sacral artery arises from the abdominal aorta opposite L4. It terminates at glomus coccygeum. It gives the branches to the rectum, sacral canal, and the fifth lumbar artery. Second artery is the superior rectal artery. This superior rectal artery is the continuation of the inferior mesenteric artery. This superior rectal artery supplies the rectum and the upper half of the anal canal. The main artery of the pelvis is the internal iliac artery. This internal iliac artery, it is one of the two terminal branches of the common iliac artery. The common iliac artery divides into external iliac artery and the internal iliac artery. So the internal iliac artery is one of the two terminal branches of the common iliac artery. It divides into two divisions, anterior division and posterior division. This is the anterior division and this is the posterior division, this one. The posterior division gives three branches, and these three branches are parietal branches, supplies the wall of the pelvis. The first one, this one, is iliolumbar artery. It arises in front of the ala of the sacrum, divides into iliac branch and the lumbar branch to the muscles of the abdominal wall and iliacus. Second one, this one, lateral sacral arteries. Lateral sacral arteries are two, and each one divides into two, which enters the anterior sacral foramina. And the third one is the superior rectal artery, this one. So the posterior division gives us three parietal branches: iliolumbar artery, lateral sacral arteries, two, and superior gluteal artery. Then the anterior division. This is the internal iliac artery, this is the posterior division, this is the anterior division. Anterior division gives the parietal branches and the visceral branches. It gives three parietal branches and four visceral branches in the female and three in the male. Okay, the parietal branches. This is the first one, going to the thigh obturator artery, which accompanies the obturator nerve. The second one is the inferior gluteal artery. And the third one is the internal pudendal artery. OII, obturator, inferior gluteal, and the internal pudendal artery. The visceral branches are three in the male, four in the female. The first one, this one, umbilical artery. This umbilical artery gives the superior vesical branches to the urinary to form the medial umbilical ligament. So umbilical artery gives the superior vesical branches and obliterates to form the medial umbilical ligament. Second one is middle rectal artery. This is the second one, middle rectal artery. And in the male, inferior vesical artery, and in the female, it is the vaginal artery. So inferior vesical artery in the male, vaginal artery in the female, and in the female, it gives uterine artery. Again, this is the internal iliac artery. one of the two terminal branches of the common iliac artery. It divides into posterior division and anterior division. This is the posterior division. It gives three branches. The first one, iliolumbar artery, divides into iliac branch and the lumbar branch. Then two lateral sacral arteries. Each one divides into two, which enter the sacral canal. And the third one is the superior gluteal artery. So these are the branches of the posterior division. Anterior division gives parietal branches and visceral branches. Parietal branches, obturator artery, this is the first one, and the second one is the internal pudendal artery and the inferior gluteal artery. The visceral branches, this is the first one, umbilical artery. This umbilical artery gives the superior vesical branches and obliterates to form three parietal branches, ILS, iliolumbar, lateral sacral, and the superior gluteal to the gluteal region. Anterior division gives the parietal branches and the visceral branches, three parietal branches and the three visceral branches in the male and the four in the female. The three parietal branches, the first one, obturator artery, inferior gluteal artery, and the internal pudendal artery to the external genitalia. The four visceral branches, umbilical artery, middle rectal, inferior vesical in the male or vaginal in the female, and uterine artery. Again, summary of the branches of the internal iliac artery. It divides into posterior division and anterior division.
Arch, the pectineal ligament and the lacunar ligament will form two important canals. Now, what were these two canals called? Muscular and the vascular space, or in Latin, lacuna vassorum and lacuna muscularum. Good job if you remember these ones. The external iliac artery will run along the terminal line of the pelvic bone, as you see here, and then eventually go through the vascular space, where it will now become the femoral artery, which is going to be the main blood supply to the lower extremities. Let's now go through the side branches. There's really only going to be two side branches of the external iliac artery. The first one is the deep circumflex artery. This one arises from the distal end of the external iliac, as you see here. From its origin, it travels along the inguinal ligaments and the iliac crest to supply the abdominal muscles of the anterior muscles of the pelvic girdle, like the psoas major and the minor, for example. The other branch of the external iliac is the inferior epigastric artery, which supplies the anterior wall of the abdominal cavity, and as it ascends, it forms a fold. So let's look at how that works. So here's basically the anterior abdominal wall with the rectus abdominis muscle here, the urinary bladder here, the prostate and the navel. And then here on the side, you'll see a fold called the lateral umbilical fold, or plexa umbilicalis lateralis in Latin. And the reason why I'm showing you this is because the inferior epigastric artery will travel within this layer and then eventually communicate with the superior epigastric artery. So it travels inside this layer, the lateral umbilical fold, and then eventually communicate with the superior epigastric artery. So remember a large side branch called the internal thoracic artery, which descends along the thoracic wall, and then at around the seventh rib, it divides into the muscular phrenic and the superior epigastric artery. So here we see the inferior epigastric ascending along the anterior abdominal wall to anastomose with the superior epigastric artery. Now, the inferior epigastric has two side branches. One of them is common in both male and female, and this one is the pubic branch. Now, the pubic branch will be your epigastric, while the internal iliac give off the obturator artery. Both of them has a side branch called the pubic branch, and when they connect, they get the name corona mortis, and the term corona mortis translates as the crown of death, which indicates the importance of these structures in orthopedic surgery especially, because accidental damage to this structure can cause significant hemorrhaging, which may be difficult to then achieve hemostasis. It must therefore be considered cautiously during surgery. So that's that one. Now, the other branch is found only in males, and this one is the cremasteric artery. It travels along the inguinal canal, a muscle called the cremasteric muscle found around the testis. Now, if you're a male, you're probably very aware of the function of this muscle. The cremaster muscle's function is to regulate the scrotal temperature for optimal spermatogenesis and the survival of the resultant spermatozoa. The other artery is found only in female, and that is the artery of the round ligament of the uterus, or the arteria ligamentum teres uteri, supplying a ligament called the round ligament of the uterus. It's a large ligament highlighted right here, and the function of the round ligament is to maintain the anteroflexion of the uterus. It's a position where the fundus of the uterus is turned forward at the junction of the cervix and the vagina, as you see here. And when the uterus grows during pregnancy, the round ligament can stretch and cause pain. But essentially, this ligament